Let's talk about the muscles of the forearm. At first glance, the muscles of the forearm can look like a bit of a horrendous area. But really, once you understand a couple of patterns about the muscles, then it's not so daunting. So first I want to start off with the muscles acting on the radio-ulnar joint. So we're going to talk about the pronators and supinators, and the lovely thing about pronators and supinators is that the names tell you exactly what they do, which is fantastic. So we're going to start with the pronator teres. You can see it goes from the medial epicondyle and it's going to go down onto the a radial tubercle, which we don't need to worry about the name of it. Now what's going to happen when the pronator teres contracts? It's going to pull the supinator over the ulna, so it's going to cause it to rotate around the ulna, and so it's a good pronator. It's also a weak flexor. Why? Because it crosses the elbow joint anteriorly, but it's a very, very weak flexor. Right, pronator quadratus. So pronator quadratus is going to go between the ulna and the radius, and when it contracts, you can see it's going to spin the radius around the ulna. So it's a pronator. Cool, supinator. Now, supinator has got two heads. One of the heads is going to be from the lateral epicondyle. The other head is going to be from the supinator crest of the ulna, which we spoke about. Inserts onto the radius, and when it contracts, as you can see, look at the fibers. When it contracts, what it's going to do is pull that radius back into parallel with the ulna. So it's going to supinate. Fantastic. Let's move on to the anterior forearm muscles. So let's look at the superficial layer 1. So this here is the brachioradialis. And we've talked about the brachioradialis, but this is more of a elbow flexor than it is a forearm muscle, which is going to act on the digits, and so we don't include these really in the normal forearm muscle layers. So these muscles here, the flexor carpi radialis, palmaris longus, and flexor carpi ulnaris, are all going to originate proximally on the medial epicondyle via this common tendon that you can see here. So flexor carpi radialis. Well, if we break it down, it sort of tells you what it does. It's a flexor, and so it's going to flex the wrist. It's going to radially deviate the wrist at the carpus. Cool. So goes from the common flexor tendon at the medial epicondyle and inserts onto the base of the second metacarpal, and that's why it's a good radial deviator, because if the third digit is the midline axis of the carpus in the hand, then it inserts just lateral to that. So if it contracts, it's going to cause radial deviation. Then if we go slightly more medially, we'll see a palmaris longus. Now this is absent in a percentage of the population. If you want to see whether you have one or not, stick your thumb to your little finger and look at the carpus. If you see a tendon, a really prominent midline, so thumb to your little finger and flex the wrist slightly. If you see a prominent tendon in the midline, then congratulations, you have the palmaris longus. If you don't see that prominent tendon in the midline, then I'm sorry, but you don't have a palmaris longus. Does it matter? No, absolutely not. You do not lose out on any wrist flexion strength whatsoever. In fact, there is some anatomists who suggest that people who have lost a palmaris longus are actually more evolved than those of us who don't. I do have a palmaris longus, and so down in the evolutionary chain, I'm still brachiating through the trees, and those of you who don't have a palmaris longus, well, you sir, you are going to be the next rulers of the universe, and I am going to be the workers to the pharaohs. We deviate. Right, muscle number 3, flexor carpi ulnaris. So it's going to be a flexor at the wrist. It's going to be doing so at the carpus, and it's going to be on the ulnar side. So this is the ulnar side. Makes sense. So this is going to insert distally at the base of the 5th metacarpal, and that's why it can ulnar deviate, and it crosses the wrist anteriorly, which is why it can flex. If we go into layer 2, what we see is flexor digitorum superficialis, which is here. So this originates partly from the coronoid process, partly from the medial epicondyle, and partly from the radius, and it goes right down into the wrist, and its distal attachment is actually on the middle phalanx. The way you can identify the distal tendons of the flexor digitorum superficialis is that it sort of forks out, so the tendon bifurcates and inserts onto the middle phalanx. So it's going to flex the middle and proximal joints of fingers 2 to 5. Cool. Right, deep layer 3, flexor digitorum profundus and flexor pollicis longus. Flexor pollicis longus is going to go and insert onto the distal phalanx of the thumb, which means that it's a really good flexor of the carpometacarpal joint, metacarpophalangeal joint, and the interphalangeal joint of the thumb, of the first digit. Flexor digitorum profundus is going to go down, and its distal attachment is on the distal phalanx, which means that it's a really good flexor of the distal interphalangeal joint. As we've said before, the flexor digitorum superficialis, flexor pollicis longus, and flexor digitorum profundus are all going to be encased in synovial sheaths, which ensures that there's minimal friction between the sheaths, because these tendons are all kind of packed together quite tightly. Now, it's these tendons that are going to be traveling through the carpal tunnels. So what do you have in your carpal tunnel? Where you have the tendons of the flexor digitorum superficialis, flexor digitorum profundus, flexor pollicis longus, and you have the median nerve in there as well. Right, what do we have here? This is our extensor group. So we're going to have the extensor carpi radialis longus and extensor carpi radialis brevis. What's the difference between the two? Well, extensor carpi radialis longus has its proximal attachment at the lateral supracondylar ridge, hence why it's called the longus. The brevis is going to have a shorter proximal attachment, and that's going to be to the lateral epicondyle. And in fact, the extensor carpi radialis brevis shares its proximal attachment with the extensor digitorum here, and the extensor carpi ulnaris, and the extensor digiti minimi. You can see how they all come back to this. This is the common extensor tendon here, common extensor tendon. So extensor carpi radialis longus, where does it go down to? Well, its distal attachment is to the base of the second metacarpal. Base of the second metacarpal. So this is sort of on the flip side of the flexor carpi radialis. So this is on the dorsal base of the second metacarpal. Extensor carpi radialis brevis is going to go down to the base of the third metacarpal, again on the dorsal side. Extensor carpi radialis longus, really good radial deviator, and a radial and a wrist extensor. Extensor carpi radialis brevis, it doesn't really have the line of pull to be a radial deviator, but it's a really good wrist extensor. Extensor digitorum that you can see here, its tendons are going to go down eventually via a complicated sort of network of tendons to the distal phalanx. So it's going to extend the joints that make up digits 2 to 5. Extensor digiti minimi, that's going to go down to the, and sort of reinforce the extensor digitorum tendon that's coming off there, and will be a really good extensor of the metacarpophalangeal joint, proximal and distal interphalangeal joints of the 5th digit. So it's going to extend the 5th digit. Extensor carpi ulnaris, it's going to extend the wrist at the carpus, and it's also going to be a very good ulnar deviator. So that's the muscles of the forearm.